Pharmacists are involved in ensuring that you're able to live your best life in spite of that injury. Hi, my name is Tosin, and I'm a pharmacist, a proud one at that. 25th of September is the World Pharmacists Day. It offers us the opportunity to tell the general public and our collaborators what pharmacists are doing beyond what they interface with every day to ensure their health. Pharmacists help protect you and keep you in good health. Pharmacists also help when you do fall ill to bring you back into good health. And if there is any accident that maims you or injures you long term, pharmacists are involved in ensuring that you're able to live your best life in spite of that injury. Now, pharmacists practice in two major settings, clinical and non-clinical. So, within our hospital systems, which is a clinical setting, pharmacists are involved in a number of special activities that makes them different from other healthcare providers. Pharmacists' practice is guided by the concept of pharmaceutical care, and what that means is pharmacists in all of their special work ensure that you get the right medicine for you, and with their support they ensure that you get the best outcome while using those medicines. That philosophy also ensures that even if you're not in ill health, a pharmacist is right for you, helping you avoid ill health. Pharmacists in a clinical setting perform pharmaceutical care and help patients who use 5 or more drugs, especially our elderly patients, through a process called medication therapy management to ensure their medicines do not interact with each other, do not affect their health, and ensures that they get the best outcome of their therapy. Pharmacists support our wonderful clinical team involving medical doctors, nurses, physiotherapists, laboratory specialists, by ensuring that after all they have done to help you get better, you do get the right drug in the right amount through the right route for the right action. So pharmacists are always watching out for the rational use of drugs, especially the rational use of our anti-infective agents, to be sure that we do not endanger our general population by using these medicines irrationally. Pharmacists are champions preventing antimicrobial resistance in all of our hospitals and through the work they do with our policymakers. Now, when you also get better in the hospital, a pharmacist is involved in helping cross-check through your discharge medications, ensuring that all of your medicines are the right ones you should have when you go home. So usually you'll find your pharmacist go through your file. Sometimes if you have a caregiver with you, the pharmacist will, your caregiver would meet with your pharmacist. They'll cross-check the medicines that you've used while you were in the hospital and the ones that you need to go home with to ensure you go home with the right medicines. Right there within the hospital, pharmacists are also involved in specialty care. Take for example, in cancer therapy, pharmacists are involved working with the clinical team to ensure that you get the right dose of those cytotoxic chemicals. Those medicines are very, very dangerous, but with the care and the loving comfort of your pharmacist, they ensure that you get only the right dose to kill off the cancer cells while sparing your healthy cells. These and many more are some of the clinical duties that the pharmacist does while in the hospital. Right there in the hospital, the pharmacist is also responsible for ensuring that the formulary used within the hospital features drugs that have evidence-based actions. So all of the medicines that are chosen and used in your hospital are decided on by a critical member of your healthcare team, who is the pharmacist. They do this using their special skills, special knowledge, and a deep understanding of medicines, their quality, and how they're made. In a non-clinical setting, the pharmacist works as a researcher, developing new molecules designed to treat diseases that we do not currently have drugs for, or developing new therapies that are better than what we had before. The pharmacist is also involved in training healthcare workers across board. Another very important member of your healthcare team is the community pharmacist. You interact with them most of the time in the community. The community pharmacist is that member of the pharmaceutical team or the healthcare team that is right there with you in your community. Most of us interact with them when we have minor or moderate illnesses, and we walk into the pharmacy, speak with our pharmacist, and they intervene by either providing advice to us to support our care, recommending over-the-counter medicines or other medicines within their specialty, and of course ensuring that we use our medicines appropriately. Our community pharmacist is a community leader, and they are always working in our best interest. If you remember, for example, during the pandemic, our community pharmacists could not leave their job posts. They had to be there. So they worked with us when everybody could not go out. Community pharmacists were going out. They were at the forefront of our fight against COVID-19, and they continue to work with us both in times of local emergencies, in times of national epidemics, and in times of global pandemics. Our pharmacists are there for us. Similarly, we have pharmacists who work in various aspects of public health. So from the areas of HIV, AIDS programming, to malaria programming, to tuberculosis programming. We have pharmacists who are working with policymakers to ensure policies that are inimical to our health are appropriately dealt with. Take for instance, 2 years ago, the Pharmaceutical Society of Nigeria, through its work in reducing access to recreational drugs, wrote severally to the President of the Federal Republic of Nigeria, made visits to the top leadership of the country, and got legislative action to back up its advocacy, saying drug abuse is becoming a national epidemic. This, of course, ran alongside the infamous BBC documentary of Sweet Sweet Codeine. In all these and more, your pharmacist is working to transform health of the public, locally, nationally, and globally. Your pharmacist is indeed here for you all of the time. So be sure of this when we say that your pharmacist indeed cares for you.